Hey, good morning, everybody. It's August 11th, 2025, and the favorite time of our week because it's Mondays with Bev and Paul. And hi, everybody. My name's Paul.
And my name is Bev. Hi, Paul.
Hi, Bev. And hi,
Here we
all of
are.
you out there in La La Land. I just
Yeah.
posted a little ditty. It was a little ditty by Kermit the Frog. I was like,
Oh,
I need
nice.
some nice little jumpy music. We should play it
Yeah,
as our theme song here. So,
absolutely.
all right, folks, we need you. We need all of you out there to support the next phase of this blitz of BioTouch. I'll tell you, this has been one hell of a weekend. I've been getting
Boy.
emails from Saudi Arabia, Egypt, Israel Palestine situation. People from
Oh
all
my
over the
goodness.
world have been contacting us. We've had people wanting appointments. We've had people wanting to take our classes. And we have something amazing coming up, a research protocol with Dr. Kenna Stephenson. I mean, it's
Well,
amazing,
of
yeah?
course. It's starting to happen. This is what we've been working towards for you for 35 years, me jumping on with you, I don't know how many years. But
Seems like
this,
ever.
yeah, I know. Yeah, yeah. But this is what we have been holding and why we've been holding it. It's time. We
Yes.
knew there was going to come just that little, and here it is. I really believe
Yep, and here it is. And so we
it's
want to
time that,
go over this research protocol. Dr. Kenna Stephenson has been wanting
yes,
to do some more research with us for years now,
I
years,
know.
but
He
we've
really
never,
has.
yeah, we never had the funds to do it. We had this, she has this machine. It's a device to measure brain activity during BioTouch. It's a little cap that fits on your head. And the device is a non-invasive brain imaging technique that measures cerebral brain activity and gleans information similar to a functional MRI or PET scan without the machine and movement restrictions. This
Wow.
technology has been used in research for 2 decades in other countries, and is FDA approval of this device is anticipated later this year. There's no adverse effects of this device have been determined at all. And so she was given this machine to
Wow.
use for 2 weeks
Wow.
as a test, because they try, of course they're trying to sell it and stuff like that. And she wanted to do this for a long time, doing BioTouch with it, and so now she's got it, and it happened quick,
Real quick.
real quick.
Yeah.
And so we have developed a protocol down here at the Tucson Center here in Tucson, Arizona. The temperatures will be nice. It'll only be in the 90s, so you don't have to worry. Of course,
Ooh, yeah.
if you're out of town. If you're in town, what do you care? 115,
Right.
90 degrees, it's all the
That's
same.
right. That's right.
So let's talk a little about this research and why we think it's important. Yeah,
No, man, do we ever.
yeah. So
What do you,
one of the things we want to talk about Kenna though too is she was just recognized recently from the University of Arizona Health Sciences Department that Kenna Stevenson was named one of top 50 women leaders in medicine.
boy, does she deserve that?
Yeah, she
'Cause,
does. she's
yeah, she does. I
she
mean, to me, she's on the cutting edge of medicine. And she has the background for that. She was in research for many, many years herself.
Oh yeah,
And
with
she,
companies like Merck and Pfizer at a
oh my
major
goodness.
university in Texas when she did her first research with BioTouch. And they
Yeah,
actually got on her case that she needed to stop her research with
right.
BioTouch or get the hell out of the
Get the-
university.
and so she did eventually.
And so what? That was 2000, what, 5 or something, like 20 years
Yeah,
ago. And
yeah,
she was a maverick. And so let's do a
yes.
little bit more about her. She wrote this book, Awakening Athena. There's a whole section on BioTouch on her first research. But she's going to continue the research she did with postmenopausal women. And
Yes.
let's talk a little bit about her statement about women in the medical system. She says in her book here, gender bias in American medical care exists. As a result, many physicians and their women patients have journeyed down the wrong path of diagnosis and treatment. Gender disparity is also evident in medical research in the types of therapy provided to men and women. Gender bias. She's been talking about that for a long time.
For a long time.
So
Yeah.
she's really a proponent for women's research, and she really wants to get BioTouch out there. She also said, what's going on with the health of the working women in America? She doesn't feel very good. She may have headaches, back pain, carpal tunnel syndrome, fatigue, sleep disturbance, mood disorders, anxiety, depression. We see a lot of stress-related disorders and musculoskeletal disorders in this critical group. It's estimated that over $200 billion a year are spent on these stress-related disorders, and most of them are preventable.
Well, that's a key right there, isn't it?
Yeah, yeah.
That is.
And that's what she found in her first research with BioTouch, isn't it?
Yes, yes.
So there's a picture of Kenna with a nurse that had learned BioTouch, and they're doing BioTouch. And again, let's show how she found in her first research with postmenopausal women that if you add BioTouch into the chronic stress cycle, which creates cortisol dysregulation, immune dysregulation, which then forms into dementias, cardiovascular disease, infections, benign and malignant tumors, mood disorders, obesity. The list goes on and on and on. We hear 85 or so % of our diseases are stress related.
Yes.
She found when you put BioTouch into that chronic stress cycle, you improve circadian pattern of cortisol release, which improves the quality of life.
Yeah.
And you increase interleukin 12 to improve immune system function, which increases the activity of genes that fight infection and cancer and promote healthy aging.
I remember when I first started going through the instructor program, and I was, looking into the research part of it and reading those articles and her research data. I remember one of the things that she said, that one of her personal conclusions was, if you were to receive BioTouch just once a week, your quality of life and health would totally start improving. That was from her own personal research with BioTouch.
Right.
Once a week.
Right.
Is all it would take, because that consistency as well as that touch is a magical combination.
We eat at least 1 to 3 meals a day. We brush our teeth once or twice a day.
Yeah.
We go to the doctor for all those cockamamie blood tests that immediately we're told you got this problem and that problem.
Oh, God.
And if we
Never
don't do
ends.
that, we take our supplements and go to a naturopath who gives you a dozen supplements to take,
Right.
and everything we do in our life, and even our meditations that we do or our yoga or everything, is to prolong a healthy quality of life. And here's something as simple as taking the index and middle fingers of your hand and lightly touching another human being on the skin, lightly like a butterfly, having the same results.
Yes.
Because, yeah.
People can't wrap their brains around that, but it's been one of our challenges, hasn't it? To put out there that here is this simple, everybody can do it kind of thing, and people just can't, they can't believe it.
Right.
Too good to be true. We've heard it all, right? We've heard all the responses.
And that's what's going to be interesting about putting this little cap with all these electrode things on the head and doing the greeting, and hopefully we'll be able to get those points in there. I'm not sure how we're going to do that. Yeah, so she thinks we can.
Okay.
And just doing the greeting in the headset and then measuring.
And maybe just A&A, Paul, if nothing else.
Oh, right. Yeah. I mean, just trying something, and we're going to practice it. We don't know really how we're going to do it yet.
Right.
And then notice the results. So this will be clinical results. It
Yeah.
won't be a double-blind crossover study.
Right.
We won't be doing fake points, but it's a great start to see what's pre and post session. Because what she found with the first research, she has this questionnaire she did in that research that measured 8 domains, 4
Yes.
physical domains and 4 emotional domains, and she found all after once a week for a month, four times I think it was 4 to 8 times maybe, all 8 domains improved. And there was a sustained effect in the 5 domains even after 4 weeks of no treatment. Okay. She found a high degree of patient acceptance. In fact, people loved it so much they weren't going to her medicine protocols. They all wanted to sign up for BioTouch.
Well,
Yeah. Low potential for harm, she says. No equipment's needed, no special room requirements, no special anything. And there's no learning curve. Once you do practitioner training or just learn the points through the manual, open your book, look at your chart, look at your pocket manual, and you can do it, she says.
you got
And
it.
that's what she loved about it, right?
Right, right. And that's why we say that it's something that simple comes along, you have to believe that, well, if it's that simple and that accessible, it must be for every one of us.
Right.
It has to be, not just a select few, not just those who can afford it. Of course, pretty much everybody can afford our classes. I mean, we've always kept that from the very beginning, never, I'm saying. But starting to do that, of course, why wouldn't we want to embrace that and really have something at our disposal that, my God, everybody can do? For me, that's like a no-brainer, and we've made it so easy to get it.
Yeah. I mean, so easy that, I've all weekend been answering things from countries, that you would never think that you'd hear from. And they're
Yeah.
swarming. Saudi Arabia and Egypt and Israel. And, it's
Wow.
just,
That's
it's
so
incredible.
exciting.
So it's grateful that we have people. Hala over there in Egypt is taking all these,
Oh my gosh.
communications, and she has classes. But like she even said to some of her people, if you don't want to take the training with me for 20, 30 hours and intensive work there, you can just get the manual. It's
At your own
$18 and you just learn it at your own pace. The words in there tell you where the points are. There's a picture, there's drawings, and then there's links to a video that shows somebody doing the system.
Doing it, yeah.
Yeah. While they're telling you where the points are.
Where the points are.
And the
Right.
points described in the video are the same as the ones written in the manual.
That's right.
It cannot get any easier. And it's only a 48-page manual. It's all the sets that we do. There are
Right.
no special sets to do. It shows you how to encourage you to do local work, which is your own intuition, because all you have to do is take those 2 fingers and lightly touch somebody where it hurts, if nothing else.
That's it.
Yeah.
That's it. I mean, come on. Really, anybody can do that.
Right.
Children.
Yeah.
Children can do it. Oh, everybody, grandmas can do it. Aunts and uncles, everybody.
Yeah. So we want to make sure that we recruit enough people to make it worth her time. She's driving down here with a couple of other of her people that help her. And,
Yeah.
they're going to be driving down 4 or 5 hours from Prescott
From Prescott.
to show up here. So we really need to recruit all of you out there who live here in the Tucson area, or in, you could even live in Mesa, you could live in Phoenix, you could live in Sierra Vista, anywhere that you feel you could drive, even if you have to drive 45 minutes to an hour to help
Right.
us get BioTouch out there to folks.
Oh, yeah. And Paul, what times are we going to be doing this?
Basically 10 to 4 on
10 to 4?
this
Okay, yes.
coming Sunday. So it'll be the
Right.
17th, and then the following weekend on the 23rd and the 24th. So put the word out to folks. In fact, as
Yeah.
I'm just talking, I know of a few people in Phoenix who might come down. Well, we've been putting out some emails. I'm going to just put it out every day. We
I know.
really need
Yeah.
to, we need to support BioTouch. We need
Yeah.
to support Kenna's commitment to wanting to get BioTouch out there. And this is our opportunity with all of you out there to really take BioTouch presentation to a next step.
Next level. And you get to participate in something that changes people's lives.
Yeah.
It'll change your life, and you can help change somebody else's lives, we get better on many, many levels. The body gets better. It's a holistic system. So, we're just saying something's happening with BioTouch and this foundation. We're ready, and we're really asking all of you to help us, because the more that we can help, the more that humanity itself is going to be helped. That's just how it works, right? So
Yeah.
this is really, really important for the foundation, and in the long run for all of us. Just take this, as Paul said, to the next level, the next step.
So contact us at office@justtouch.com. Send us a message through Facebook here. You can call us 520-323-7951. It's streaming along the bottom there. Go to justtouch.com and just click on contact us, however you need to get hold of it. And if you don't live here in Tucson, but you know of people, tell them about it. Tell them to contact us or get hold of us, and we'll contact them. We really need to fill up that schedule. It'll take 30 to 45 minutes out of your day. But the help in getting something simple and as effective as BioTouch is worth 45 minutes. It's worth 45 minutes of our lives.
Sure.
So please step it up, come help us, and we would be so grateful, and humanity would be grateful, I think.
I think so.
I must believe that after doing this for 35
You do.
years.
I know you do.
What else do I have to do right?
Well, that's it. But now the doors are opening. The opportunity is being offered.
Yep.
Like I said, not just us, but humanity. So we can get this out there.
And I'm also thinking too, I think if she does this next phase of her research, and now that she's an adjunct professor at the University of Arizona, I think this might get us in the door finally to get in the university. I mean, we've always been asked, sure,
We kind of skirted around.
Yeah, because there's never been anybody in the right, We hear you. Go away.
Yeah.
here's a dog bone. Now go away.
Thank you. Goodbye.
So we really want to support Kenna, who's supporting BioTouch and believes in it. She believes in it. And we want to help support this. So get hold of us, and we'll let you know what the results will be as soon as they come in. Otherwise, we'll see you all next Monday, and we'll be talking about this again. Take care, everybody.
Bye.
Days in and days out, space and time is all about feeling pressure with the pain, in sunshine or in the rain. Living is a place in mind, giving is being kind. When the pain is too much, what we need is BioTouch. When I'm touching you, you are touching me. It's a simple thing to do and a natural way to be.